Welcome, everyone, and thank you for attending today's Public Health Communications Collaborative monthly webinar. I'm Nadine Gracia, the President and CEO of Trust for America's Health. As always, we try to select the topics that will be of greatest interest and support to you. Throughout the pandemic, we have seen the important role that businesses can play Apologies for that, everyone. My screen just froze and I was getting an error message. I'll start over again just so that we can re-begin the recording. We have seen the important role that business can play as a communicator, working in partnership with public health departments to amplify consistent guidance to employees, consumers, and community members. Today, we're going to hear from 3 leaders with timely advice on how to partner with your local business community on messaging for the upcoming holiday season and ongoing COVID-19 communications. This webinar will offer insights, practical tips, and case studies from both the public health and business perspectives, with lessons learned from the pandemic that can serve public health communications both now and in the future. We are thrilled to have 3 esteemed panelists joining us today. Dr. Nafissa Cisse Egbuonye, who is the Public Health Director of the Black Hawk County Health Department in Iowa, Stephen Massey, co-founder of Meteorite and Managing Director of the Health Action Alliance, and Laura Holmberg, Vice President of Marketing and Industry Communications for the U.S. Travel Association. Now, for everyone in the audience during the panel, please feel free to submit your questions in the chat by sending a message using the Q&A button at the bottom of your screen. Our speakers are going to answer as many questions as possible during our time together today. And as always, today's webinar is being recorded, and that recording will be available on the Public Health Communications Collaborative website later this week, along with all of the previous webinars we have held and other COVID-19 communications resources. Next slide, please. Now, before we get started, we want to give our speakers a sense of who is participating today and your most pressing communications challenges. This will also help them answer your questions later and help us plan for the future. Now, in the Zoom pop-up box, we like to ask you to answer these 2 questions. Which term best describes where you work, and what is your most pressing communications challenge? So are you in governmental public health at the state or local level, an NGO, healthcare facility, or other sectors? And what is your most pressing communications challenge, whether that's vaccine distribution or confidence, trust in public health, message consistency? I'll give you a moment to take that poll question.
We're having a technical difficulty, Nadine. The poll is not opening.
All right. Shall we continue, Tim, or would you like me to wait for the poll?
Let's go ahead and continue.
Okay, well, we will continue. And thank you for sticking with us through just a couple of technical issues. Well, we're going to move then into our conversation for today, again, with really an impressive group, and we'll start with introductions. First is Dr. Nafissa Cisse Egbuonye, who is the Public Health Director for the Black Hawk County Health Department in Iowa. Since 2016, she has worked to establish her department as a leader in health promotion, disease prevention, and health equity. She is a recipient of the National Research Service Award from the National Institutes of Health and a Diversity Research Fellowship from Texas A&M University. In 2020, she received the Iowa Public Health Heroes Award from the University of Iowa. And she is also a member of the 3rd cohort of the Kresge Foundation's Emerging Leaders in Public Health initiative. Next is Stephen Massey, the co-founder of Meteorite and managing director of the Health Action Alliance, which is a joint initiative of Ad Council, the Business Roundtable, the CDC Foundation, the De Beaumont Foundation, and the Robert Wood Johnson Foundation to strengthen the business response to COVID-19, improve health equity, and help rebuild public health. And finally, Laura Holmberg, who is the Vice President of Marketing and Industry Communications for the U.S. Travel Association. Laura joined the U.S. Travel Association in 2007 and as Vice President of Marketing and Industry Communications within Public Affairs. She oversees all activities pertaining to the U.S. travel brand, event, print, and digital marketing, and creative services, as well as the development of all industry-facing communications such as research and policy materials, executive speaking engagements, and social and digital media products. Nafissa, Stephen, and Laura, thank you so much for joining us today. It's such a pleasure to have you on for this really important conversation.
It's great to be here. Thanks so much.
Absolutely. So we're gonna dive right in and get started with our first question for each of you, and be able to also provide some opening remarks, and certainly on a timely issue as we've described. You know, we're approaching the holiday season, so it would be great to hear what's your number one focus right now on getting information out that will help people to have the safest holiday that they can have. Nafissa, why don't we start with you, and then we'll move to Stephen and then Laura.
Thank you. Thank you so much. And so excited to be here. So number one thing for the holiday season, for us, it's really about celebrating the holiday in a safe way. And so we are promoting COVID-19 vaccination with now the eligibility for kids 5 to 11. So we're focusing on that. And a lot of communication in regards to the importance of COVID-19 vaccine, why it's important to get vaccinated, especially prior to the holidays and the gatherings. So that's occurring. Secondly, we're also ensuring the availability of COVID-19 test kits. We've disseminated the test kits throughout the community. We leaned on to faith-based organizations to help us with that. And so, for us, it's important for us to communicate and provide the information, but we have to ensure easy access. So we're doing those things hand in hand, and also communicating in multiple languages. You know, here, Black Hawk County, we're a population of about 131,000, but we are considered to be one of the most diverse counties in the northeastern part of Iowa. For example, in Waterloo, we have about 75 different languages spoken in Waterloo School District. So we are thoroughly engaged with our different community leaders, translating the different communication in multiple languages, also utilizing different channels of communication, and asking the community, what is your best method of communication that for your community members? So culturally appropriate messaging and utilizing trusted sources, trusted community leaders to also promote holiday safe practices, and also the COVID-19 vaccination. So a lot of things are happening very fast for local public health here, but it's about promoting and ensuring easy access to COVID-19 vaccine. Thank you.
Great. Well, sure. Well, thank you so much for having me today, having me here today. And also thank you to PHCC for your partnership and really for doing so much to advance public health messaging throughout the pandemic. At the Health Action Alliance, we aim to unlock the power of business to strengthen the response to COVID-19, advance health equity, and help rebuild public health. And we've shared many of the great tools and resources developed by PHCC with businesses in our network. I think at all times, but especially right now, we are really focused on making sure that employers have the tools that they need to support their employees who choose to get vaccinated. As of today, about 30% of American adults are still unvaccinated. So we continue to focus our energy on ways that employers can encourage vaccinations and make it as easy as possible for workers to get their shots. I think as many people on today's call also know, OSHA has issued new rules for employers of 100 or more employees that require their workers to be vaccinated or get tested at least weekly. Now, these new rules are on hold while a federal appeals court hears a legal challenge to the rules, but companies still have lots of questions about what might be coming. And so we've been focused really squarely on encouraging employers to continue to do things like provide paid time off and have vaccine conversations with their employees. Even now, about 200,000 adults are still getting their first COVID-19 shot every day. So vaccine requirements certainly play a role here, but employers tell us that having conversations based in empathy and listening to workers' questions and concerns and really meeting them where they are is still effective and essential. My colleague just mentioned about 28 million children who just 2 weeks ago became eligible for COVID-19 vaccines. At the Health Action Alliance, we are encouraging employers across the country to support working parents who might need extra help getting their children vaccinated. About half of all working parents who make less than $50,000 a year say that time off from work is an important barrier that might prevent them from getting their younger children vaccinated. Now, we know vaccines for kids will help keep schools open, keep kids safe, and keep parents at work. And so we're encouraging every employer across the country to support working parents who choose to get their children vaccinated, give them the support they need by offering paid time off to attend those vaccine appointments or flexible scheduling that will allow them to do so. Finally, I'll just say that we are, in addition to COVID-19 vaccines, we are encouraging employers to support employees who need time off to get flu shots, or consider hosting on-site flu or COVID-19 vaccine clinics to make sure that both employees and their families are safe. The CDC has warned that we are at risk of a really potentially serious flu season. So we've recommended that employers do take actions to make it easier for workers to get flu shots. So between employees and their kids, COVID and the flu, there's a lot of work to do, but employers are really well positioned to help keep workers safe and communities safe. And that's our role at the Health Action Alliance.
Thanks,
I
Steve.
guess I'll go next. You ask about the safe holiday season, kind of U.S. travel's main focus, I guess, on behalf of the travel industry. And, our focus is clearly travel. So, we have travel top of mind. We know that this is going to be a priority for folks leading into next week. And, in order to have a safe holiday season, you want it to be enjoyable. So that means, making sure that travelers are prepared and that you're setting the right expectations for what they're going to get themselves into next week. AAA came out with a report about 2 weeks ago. There's going to be 53 million people that are traveling next week. To put that in perspective, that's about 15% above the number of the volume last year. So people are starting to travel again. We've seen it pick up over the summer. We're going to see peaks over the holiday season. So we're about 15% over last year, but we're back to pre-pandemic levels. So if you remember going to the airport or, back before the pandemic, if we can even remember when that was, and airports were busy. There were a lot of crowds and roads were congested, and now there's more construction than ever on the roads. So we want to make sure that travelers are expecting long lines and crowds, which will make social distancing a little difficult at airports. But we also want to make sure that they're prepared and they have the most recent rules. So when it comes to domestic air travel, no vaccine mandate or testing requirement to travel, by air domestically. So we'll make sure that we're communicating that to travelers. But there is that federal mask mandate still in place for airports and airlines. So just want to continue to convey that to those travelers that are traveling by air. And then again, if you're traveling by auto and encountering those crowds, you're going to get them, at rest stops and stops along your journey, so plan appropriately. And then, the travel industry is also focused on just making sure that, the traveler is doing their research. We're very used to being inside of our own community, and we've seen the, signs outside of the establishments that we frequent. We know what the requirements are when it comes to face masks and coverings. But when you're going outside and you're visiting friends and relatives in another destination, you need to learn the rules of that destination. They're not the same as your own. So just making sure that people are doing their research. And if you're visiting a museum while you're, going to see your cousins, you understand that there's a vaccine mandate in place for indoor activities that does exist in some destinations, but not all. There's no one size fits all requirement when it comes to kind of these policies. So we just want to make sure that travelers are doing their research. And that goes also to, if folks are staying in hotels, right? So there's no, universal mask policy for guests and face coverings at hotels. You'll see employees with face coverings, but the policy will differ by property. So we just, you want to go in with the right expectations, and frustration does not lead to an enjoyable travel experience. So just ensuring we're communicating all the rules of the road and making sure folks are prepared is, I think, one of our #1 focuses.
Great. Thank you all. Definitely sharing really key and important areas of focus, the ongoing outreach and education, ensuring access to COVID-19 vaccination. Nafissa, you brought up testing, to key points about policies that we in public health have been advocating for, such as paid time off, paid sick leave, to be able to actually access the vaccine or having it on site, to also doing that outreach and education, ensuring that people know what are the expectations and requirements so that they can travel safely and have an enjoyable experience. We're talking about this importance of the partnerships between public health and business. And Stephen, you started to speak of the mission of the Health Action Alliance. Can you take a step back and actually tell us, how this came into existence? Tell us a little bit more about the Health Action Alliance and some of the key priorities you started speaking of, the coalition, and what you would consider some of the biggest successes you're already seeing and learnings to date.
Yeah, well, thanks for that question. I think that what we've learned throughout the pandemic is really the central role that the business community can play and delivering public health information and encouraging safety, and now encouraging vaccinations. From the very beginning, in March of 2020, when the pandemic struck, the business community was really asked to transform in many ways to meet the challenge by closing operations or shifting operations in order to protect workers, educate workers about the safety issues once vaccines became available, to really the Biden administration really leaning on employers to offer things like paid time off to make sure that workers had access to vaccines. All of that is because the business community in this country is really trusted. In fact, what we know is that 72% of workers trust their own employer for vaccine information. That's right behind their doctor as the second most trusted source of information. And workers expect their employers to take actions for their health and safety. 4 out of 5 American workers are looking to their employer to lead. And over the past 9 months, since we created the Health Action Alliance, employers have been a transformational force for vaccine uptake. Now, we were created as an initiative of 5 organizations, leaders in public health, business, and communications. Our founding partners are the Ad Council, Business Roundtable, the CDC Foundation, the De Beaumont Foundation, and the Robert Wood Johnson Foundation. And the idea was that if employers are trusted sources of information, let's make sure that every employer in this country has access to information that's based in fact, and tools and resources and guidance that will help them deliver that information and support their employees with policies and programs and educational outreach that will remove barriers to vaccines and make sure that employees receive, again, fact-based information, really being responsive to all of the disinformation that's out there. And so our work over the past 9 months has been to educate employers, to provide communications tools and resources, to provide policy guidance and clear recommendations for employers to help remove barriers and improve and increase access to vaccines. What we know is that 3/4 of workers whose employers encourage getting a vaccine have gotten at least 1 shot, compared to just 41% of those employers who didn't provide that kind of encouragement. Also, 75% of employers that offered paid time off to get vaccinated and got at least 1 shot, whereas just 51% of those workers who weren't offered PTO were vaccinated. So the business community here is really driving vaccine uptake with the kind of encouragement and policies like paid time off that they're putting in place. Finally, I'll just say that the Health Action Alliance, in addition to being guided by some of the best minds in communications and business and public health, we also reach scale and leverage partnerships with both industry associations like the U.S. Travel Association and others, and leading public health groups across the country, local chambers of commerce, local industry groups. That's how we reach a large number of businesses. Thousands of companies across the country have accessed these tools and resources and attended our training sessions. So we're really proud and excited of the reach and the impact just over the last 8 months.
Some great examples, Stephen, and really making the case and painting that picture of the key role, right, that businesses can play with regards to doing this outreach and education, providing, the sites and ability to actually, whether it's education about vaccination, but also promoting health and well-being, right, of their workforce. And so being another trusted partner with regards to these important efforts. Laura, you too, in your communications are doing a great deal with regards to the pandemic and navigating messaging and communications for the travel industry. How is that impacting your approach really to building the communications and the partnerships, not only for the pandemic and this holiday season, but even beyond, how you're communicating that within the industry and the role that the industry can play in these important messages?
Well, I mean, we're all, very accustomed to, strength in numbers, and, you can really, a message can be so much more powerful by creating this echo chamber through these massive networks, Stephen just spoke to, and we have our own as well. We're a trade association that has 1,100 members that are all, major travel brands and destinations and state tourism offices that have direct access to consumers, who, need to know public health information, and that, are maybe, interested in travel and need to understand the latest policies. So we lean into that membership and that distribution network to help to unify our voice and really provide a messaging framework. And as Stephen has noted, resources and tools, very plug and play, to be able to drive kind of the industry's message and positioning forward, through the power of these channels that our membership has at their fingertips. One example of that is, as travel brands and businesses have been putting in place all these cleaning practices and programs and protocols since the beginning of the pandemic, consumers are getting a lot of information from a lot of different sources. Hotels are doing one thing, airlines are doing another. Here's what to expect at an airport. But what we needed to do is we needed to thread that comment, have a common thread through all those messages to say, collectively as a travel industry, we're prioritizing your health and safety across every point of your travel journey. So whether you're staying in a hotel or boarding an airline or going to visit a theme park, here is what you can expect from a health and safety standpoint. So we developed a campaign called Travel Confidently. At the onset of the pandemic, I think we've probably updated the resources maybe a dozen times over the past 20 months. And we put them in the hands of our membership to say, these are complementary messages to everything you're doing already. But together as an industry, we can make sure consumers know that we have their utmost health and safety in mind, across the entire travel journey and experience. So, I mean, it's incredibly powerful when you're kind of working together to really amplify, one of those core messages that you want to make sure you're getting out on more channels than you're able to accommodate on your own.
Absolutely. Leveraging, as you've noted, that power in numbers and really increasing your influence and reach as well. Important lessons, certainly, Laura. Thank you. Now, Nafissa, you bring uniquely that local perspective, right? And many lessons that can be learned from how to communicate with businesses, how to partner with businesses. And you've been very effective, really informing some key partnerships with businesses in Black Hawk County. And I know that there are departments across the country tuning in today who would really appreciate hearing from you. How did you get there with regards to these partnerships, and what impact has that had in your county specifically?
Thank you for that. Number one, always cultivate a relationship, or yes. So I use the word relationship more frequently than partnership, because I think relationship creates an environment where businesses are also vulnerable enough to where they can communicate what are some of the support they need, right? So partnership to me tends to be very technical. And so for me, my first thing is that be intentional about creating relationships, with our business community. Very often public health is seen as a regulatory, and so enforcement comes to mind for the business community. And so immediately when we had the Tyson outbreak, one of the things that for me was so important was that I didn't want media to polarize us. This is not public health against, corporations. And so my approach was that there is a situation, there is a very difficult situation happening today in our community, but how can we work collectively to ensure the safety of all our community members? And so I think by taking that approach with big corporations such as Dyson and our local businesses, they were able to be vulnerable to call us and ask us for feedback on their safety protocols. What are some of the communications they need to have with their employees and the difficulties they're having with that communication, so that we can partner and help them and support them in this. And sometimes, to be honest, I would say, you know what? Let me be the one to communicate, or let the health department staff be the ones to communicate. And so it allowed them to also not be polarized within their own business, and also to gain our support in some of the messaging. So I think for us, what was really effective is building that relationship, creating that space for business communities to be able to be vulnerable and say, this is too complicated for us. Guidances are coming really fast. We need your support in understanding, and what are some of the strategies that we can implement so that our employees are safe. And so we were able to do that. We were also able to mitigate some of the communication. For example, with the Tyson food outbreak, we work closely with not only Tyson, local management, the corporation, but we also worked with community members, community leaders. And when the NAACP got involved, we didn't shy away from those difficult conversations. We had to have them. Those are some of the key things that is also important in order to mitigate an outbreak such as COVID, as it relates to Tyson, was really to partner with different sectors and have those difficult conversations at the time it was occurring. So I think that for us, we had a partnership with many organizations, but COVID tested our relationship. And I can truly say that through this test, we were able to cultivate a deeper relationships. And so I'm part of now the Chamber of Commerce for the county. And we provide town hall meetings for our business community. And also we do this offline where, if some businesses have questions, they can directly communicate with us. So creating really that space for businesses to be vulnerable, to communicate their needs and messaging strategies. I think that's really important for local public health to be in partner with the business community to do.
Such an excellent example, Nafissa, that you're providing, and you spoke, so many lessons learned with regards to, as you noted, you have the partnerships and COVID, then testing the relationships that you have. But that what evolves out of that, as you noted, is now having a seat at the table within these business conversations. And also importantly, who is that trusted messenger, right, in the community? And that can be different depending on the communities that are being served. Who is the trusted messenger to be able to give that communication and messaging throughout a community? For the last question, just before we go into audience Q&A, I'd like to ask, and this is a question for all of you, and your considerations, and Nafissa, you brought this up in your opening remarks, is about that inclusivity of messaging and communications. The types of communications, what channels you're using, the types of resources that you're sharing, and also ensuring that that information is accessible and available, for example, in multiple languages, so that it's culturally and linguistically appropriate to reach diverse communities. Are there tips that each of you can share that have helped you really in reaching even more people and communities than you might have been able to otherwise? And why don't we start with Stephen, and then we'll go to Laura and finish with Nafissa.
Yeah, great. Well, first, I want to thank and acknowledge all the public health leaders that are on today's call, because businesses across the country have turned to you during this really unprecedented pandemic for your help, for your guidance, and for your support. And so on behalf of the business community, I just want to say thank you for your leadership and for supporting businesses across the country who've had questions and needed your guidance. First and foremost, we really do encourage businesses to cultivate trusted messengers, both within their organization and outside their organization. Within their organization, many businesses have health and wellness staff who, of course, are seen as trusted leaders, but there are also other communities within a company that can be and should be cultivated. That includes employee resource groups, diversity professionals, line managers, HR leaders, others who have the trust and the relationships with individual employees or employee groups, especially groups of employees that have been disproportionately impacted during the pandemic, or who might have unique questions, concerns, or access needs. It's great to have the CEO share vaccine information and encourage vaccinations, but in some cases, it might be even more effective to have employee resource group leaders, HR professionals, or others within a business share trusted vaccine facts. Outside of a business, many employers are looking to local public health departments or local physicians or other leaders from specific communities, religious communities, minority communities, other groups that might be able to help build confidence in vaccines or share facts about vaccines and COVID safety. I'd also say that it's important to have messaging and fact sheets and other materials in Spanish or other native languages, and whenever possible, to host events for your workers in those languages, and events that feature people who reflect the unique needs of the diverse communities within your workforce. And finally, we encourage, whether in written communication or in conversation, that employers should really work to build trust and express empathy. Employers should listen more than they talk, and listen for what's holding people back, and help them find their own reason to get vaccinated. You know, we often say that this isn't about trying to convince anyone to do anything. This is really about listening to the concerns of your workers, and listening to their questions, acknowledging their questions, and trying to connect them to resources like local public health leaders, physicians, and others who can help them get the facts they need to make the decisions that are right for themselves and for their families.
I would just echo that. I mean, what both of you have said, just around, spokespeople and, building testimony within the business community to help as kind of additional voices to add to, I mean, even from a local media perspective, just making sure that there's people within the business community that, can be called upon to speak to local media around, a certain update as well, because they always have kind of the latest messaging is incredibly important. I'll say just in terms of, I mean, you ask like, how do you reach more people? I mean, the best way to reach more people is to be everywhere. So, leverage every channel that you have. Don't be afraid, to repeat and remind. I mean, we're all consumers, right? We're thumbing through on our mobile phones, through our email and through Twitter, and we're not absorbing every piece of content that comes across our device, but we might remember something that was catchy in the subject line, or at a certain point of the day. So don't be afraid to kind of repeat, retweet, share, make sure that you're putting yourself into the conversation to just reach more people than you may normally reach through traditional communications. I'll say, another way to kind of break through the clutter is, this is very tactical, but, video is a great way to break through and kind of convey, a message. And we're all visual people. So just to kind of leverage video, which is incredibly shareable content. I mean, another way to reach more people is to make easy, accessible content that people will want to share with their own networks, not only consume on themselves, but, hey, this was really interesting. I never thought about it this way. Like, check this out. And that's really powerful through video. And video is also accessible when you talk about inclusivity in terms of, being able to translate video, text on screen, closed captioning. So it's a very accessible to, I think, diverse populations as well. And, it probably has a longer shelf life than you think. It takes a little bit of production and probably talent to put it together, but it's incredibly effective.
Thank you. So for us, our theme has been nothing for the community without the community. So again, very intentional about asking the community, how do you best receive information, right? So for example, we found out with our newcomer population that some of them, it doesn't matter whether we use YouTube, Facebook, the news channel, that WhatsApp is their go-to for information. And so we've launched a WhatsApp initiative where we have a group, and it's a lot of the different community members that this is the way that they receive information. And so we share information through that venue. So I think that for us, the most important thing is always asking the community, how can we best serve you all? And through that, we then inform the business community. We say your team members, for example, I'll use Tyson because that's what made national news, and they know I'm talking about them today, by the way. So then they're okay with that. But we said to them, hey, your team members, the information that you're sharing, it's not working. Like, they need more information. They need videos. They need interpreters to explain. And so through that, we were able to look at the different strategies of communication that best serves their team members. And so I think for us, the biggest message to the community throughout this crisis has been nothing for you without you. So we are a partner in this together. And so that's how we were able to effectively communicate in a culturally appropriate manner. So again, always ensure that, especially with these guidances that are so technical, that it resonates to people. People are not used to reading this type of information, and be comfortable with questions that might seem obvious, obvious to one, but might not be obvious to the other person. When Tyson mandated the vaccine requirement, they were so concerned, they were so worried they were going to lose their team members. And so I asked the disease surveillance team here, I said, you know what, we're going back into the plant. We're going to sit there during lunch hours, and people are going to ask us questions. Some might be obvious, some might be hilarious to us, but it's okay. These are questions that are important to them. And so seeing us there also, I think, helped. They end up having a very high vaccination rate in the plant. So that was successful, but really creating that space for people to be able to get information and not feel intimidated throughout the process has been something that we found to be very useful.
Great examples, great tips from all of you. And we're going to dive right into some audience Q&A now. And we've got some questions that are streaming in. So here is a question, and this is in response to some points, Stephen, that you shared. So the question and our comment is, I work at a local health department in the Northeast. As a case investigator, contact tracer, I was wondering, when you spoke of giving parents more access to getting their children vaccinated without them missing work, has there been a discussion of pop-up clinics at the schools to offer children and parents the opportunity to get children vaccinated with signed authorization forms from their parents, or what other recommendations have been effective?
Yeah, that's a really great question. Of course, we all want to make it as easy as possible for parents, and especially working parents, to get their kids vaccinated if they choose to do so. I think those suggestions are great ones. And I imagine that Nafissa is working with the local school district in her community to host pop-up clinics at some schools. Across the country, businesses are also stepping up to this challenge by hosting pop-up or on-site family vaccine clinics at their workplaces. So making it easier for workers to get vaccinated, and also to bring their children or their family members to their job site to access vaccines. It's important to also keep in mind that many working parents may work more than one job and might not have traditional working hours or regularity in their schedule. So I would encourage public health leaders to consider partnering with the business community to host on-site clinics, both during the day and potentially in the evening or during overnight shifts for workers who, again, don't work traditional hours, or who might not be able to bring their children or their family members between 9 and 5. So those are really great strategies. Bringing the vaccines as close as possible to the worker reduces that friction and makes it just as easy as possible for those workers to get vaccinated. I'll also say that we work a lot in rural communities with the American Farm Bureau Association, the Rural America Chamber of Commerce, the National Rural Health Association, and many of our partners in rural communities communicate to us that there are real challenges in access, particularly to find physicians and other medical professionals who might represent your community or be able to answer questions that are really specific to communities of color. And so, one of the ways that we encourage employers to step up here is to offer time for both employees to get the vaccines, but also to potentially travel to meet with physicians or other community members in adjacent communities that may be better served to answer their questions. So again, just really meeting employees where they are, understanding the challenges and access gaps that they might face. And for working parents, making sure that they have extra support to get those kids vaccinated now that they are eligible.
Terrific. Thank you, Stephen. And we got another question that I'll ask Nafissa to take the lead on. This is a question that says, I work at a local health department in Colorado. Businesses tend to have a harder time enforcing public health orders among patrons more than staff. As a public health employee, what strategies and language have you found most effective when communicating with businesses around this type of enforcement? For example, patrons who refuse to wear masks.
Yeah, ooh, that's a difficult one. That's a very difficult one. But I think that for us, we've throughout this pandemic, because we've been polarized, we recognize that enforcement strategies hasn't been really helpful, especially when it's not supported. So I think that for us, that education, continued education, and working closely with the business to ensure that education is happening. And that's really where we're at right now, the education component, and also access to vaccination. So I do know that there are some people that weren't really in favor of the mask, but did get vaccinated, right? And so just like Stephen said, we ensure that access to vaccinations was easy. And so if we had a business that wanted to have on-site vaccination clinic, we were there. And so I think that the most important thing is that, a continued education and creating access to vaccination also is important.
Terrific. This next question, and Laura, maybe we'll have you take the lead on this, but I think, both Stephen and Nafissa may also want to weigh in here. A physician, and this is a question saying, I am a physician working in the health policy space and wanted to learn more about lessons learned. Can the panelists talk more about communication strategies or messaging they've tried or heard of that were ineffective, so people watching will understand what does not work? So Laura, with obviously your communications expertise, lessons learned that you've seen in this space.
I mean, I think one of the things that you could do wrong pretty quickly is to overcomplicate. Obviously the information is complicated on its own, and if you're linking to the official sources for, the full information and the rules around something, but you can simplify it in a way that, connects with people. It's so important to make, any guidance accessible and simple. So, I mean, that would probably be my number one, tip to avoid would just be, take the language and put it in the words of the consumer, make it relatable and accessible to them, and leave kind of the legal jargon for the official, the official documents, that you can source and they can go to for more information.
Great tips and lessons. Stephen, anything you'd like to add there?
Yeah, I think it's really important to always lead with empathy and be positive and encouraging. I think what we've learned not only during the pandemic, but from years of research on public health and behavior change communications is that shaming or fear-based messaging usually doesn't work. We really believe that employees want to make the right decisions for themselves and for their families. Everyone in this country wants to stay safe. We all want to feel protected. Most American workers want to work in a workplace where they feel safe and protected too. And so, for employers and really for all Americans, I think the opportunity here is to lead with empathy, really listen to the concerns that folks have. At the end of the day, we are asking Americans to make decisions that for themselves and for their families to protect one another. And the science here is really clear. Vaccines work, safety works, and leading with empathy and trying to connect at a human level really is a better strategy than shaming or using fear-based messaging to try to convince folks to take action.
Absolutely. And the points you raised, both of you raising about clear and concise messaging, really avoiding complication, but assuring that you're also meeting the needs and accessibility for the communities and consumers you're reaching, and that empathy, critically important. Nafissa, any additional points you'd like to add with regard to that?
I would add, since it was a physician that asked, one of the things that we did was have a unified front with our healthcare system. So our PIOs were meeting weekly, and they continue to meet weekly because that was so important for the community to not get different messages, like from our healthcare systems, from public health. So it was a unified front. Streamlining communication is so important. Sometimes, unfortunately, the community would hear information from the state prior to hearing from local public health. And so it would be a struggle for us to figure out what was going on at the time, and the community's asking us questions. And so those are some of the things that we fleshed out with the state, also the importance of us also receiving the communication and being prepared when they're releasing their communication, so that we are better equipped to answer the questions that the community has. And so having that unified front with the healthcare system has been tremendously beneficial and in streamlining communication from the state as well.
Terrific. And what we're hearing, certainly in this as well as previous webinars, we're hearing that important role of these multi-sector partnerships, these relationships, as Nafissa has importantly noted, that this is not work that public health does alone, and how we can build those relationships, and also ensuring the other sectors see public health really as a trusted partner in this work. And that really ties to our next question again, which is another question I think the audience would love to hear from all of you. That is, I want to form more partnerships with local businesses in my community, but I'm not sure where to start. What steps would you recommend that I take to build those relationships? And Stephen, why don't we start with you, certainly through the lens of the Health Action Alliance, where you've seen some promising approaches and practices to building those types of relationships effectively.
Sure. Well, first, whoever asked that question, we'd absolutely love to hear from you. So please reach out to us at hello@healthaction.org. We have lots of great partners and companies around the country, and we'll do our best to try to connect you to local employers in your community. I'd also say that most communities have a local chamber of commerce, and even in small communities, the local chamber of commerce is a really great place to start. Business leaders are used to coming to those groups to share challenges that they might be facing or look for help. And so that's a great, we find that local chambers of commerce are really great resources. You might also try to just kind of do a bit of a landscape analysis or survey in your own community of who are some of the largest or maybe the most consequential employers in your community? Or are there specific business leaders in your community that might be able to help tip the scale and convince other businesses to work with you? Find out who's who in your community and begin to reach out. Oftentimes it's difficult to get meetings with a CEO, but certainly if there's a medical team or a health and wellness team at a company, I can't imagine that they wouldn't take a call from the local public health department. You might also reach out to local employee resource groups, affinity networks, HR leaders, or other trade groups that exist within your community. Finally, many communities, I live in Portland, Oregon, and so Laura, I think will appreciate that most communities have a local travel association. And so those groups tend to know the community pretty well and also are pretty connected to the business leaders in a community. So if you were in Portland, Oregon, I would certainly encourage you to be in touch with Travel Portland and they can connect you to some of the major employers in town. So I think those are probably the three best strategies that I'd recommend, but certainly we'd love to hear from you.
And I would add to that, Stephen, that, professional associations too have chapters, in local markets. So if there's, an interest within, your sector, to be able to just be a part of that and network and engage, that's, one way to get involved too. And it's very simple, but, just engagement on, social media, like a LinkedIn, and connecting with business leaders in your community, and just kind of knowing, who is surrounding you, and familiarizing yourself with those names and those profiles, kind of doing your homework a little bit, is probably a good place to start too.
And just to add one more point here, I think, for the public health community, it's really important always to understand what the needs and what businesses really need right now. And if you think about, what challenges business leaders face across the country, we're hearing about labor shortages, worker absenteeism, challenges around retaining workers. There are public health solutions to those challenges. There are ways that public health leaders can help reduce employee absenteeism, improve employee retention. Going and approaching a business with that in mind is always really helpful. I promise you, a business leader is going to be much more interested in having a conversation about ways that you can help reduce employee absenteeism and improve employee retention than they would be to just say, hey, let's have a meeting about public health. Employers are right now concerned about bottom line issues. How do they keep their workers safe? How do they recruit and retain workers? How do they bring customers back into their retail, restaurant, and travel establishments? And so having conversations around meeting the needs of businesses and supporting some of their priorities is likely to help build the relationship that Nafissa was describing earlier.
And I want to add, there's a report that was published by the DuPont Foundation, and it's Good Health is Good Business. I highly encourage people to read that. It's a very good report. But I also want to say that good business is good health, right? So the two go hand in hand. And I think that one of the things I've learned as a public health leader is that it's as a society, we separate government entities from the public business sector, and it seems as if we can't have those relationships. But I think that utilizing the opportunity, just like Stephen say, where we can discuss where those connections are, right? I think as public health, our role has been a convener. We know how to establish these partnerships, right? And so I think that don't be afraid to go and just have a simple coffee, and you discuss your values, your priority, because at the end of the day, we all serve the people, right? So I always communicate that the same people that you employ interact with public health. And so how can we make this partnership work so that we can cultivate that healthy community? And so I think it's just by having these, starting off with informal meetings, and so that really you get to know each other, and then figuring out strategically how their strategic priorities align with yours, and then how you can cultivate that partnership.
Terrific advice that each of you are providing, and we could speak to you for several hours on this topic, but alas, we are coming towards the end of our hour, and so here's our final question for today's conversation. Here at the Public Health Communications Collaborative, we're always focusing on actionable steps that people can take to be more effective communicators. Can each of you share, one go-to communications resource or a practical tip that people can take with them today from each of your perspectives? And you've shared some resources. You might want to rename something that you mentioned earlier, or maybe a new resource that we can share with our audience today. Let's start with Laura, then go to Nafissa, and we'll end with Stephen.
The old mute got me there. I mean, we're a trade association, obviously, and I work under public affairs. So our focus is, advocacy and policy and lobbying. And, so one of our go-to resources is Public Affairs Council. They provide a lot of good, tips and, educational sessions and thought leadership. So they're a great resource. And then I would just say, like, align yourself with your peers and other communicators, outside of your community. Learn. It's so valuable to learn from others in your space and seeing what they're doing and sharing best practices and just making sure you're building your own network. And doing so with peers, and you're establishing those relationships and you're cultivating them to really foster some two-way learning between each other.
For me, I would say trusted sources, members of the community. Utilize them as key partners in messaging. I found out that, no matter what we say in public health, if your church or faith, whichever faith you practice, does not support the message, it can be problematic, right? And so I think that for us, it's leaning on to trusted sources. Sorry, today I'm struggling with my speech, but trusted members of the community, so that people, hear the same message and it doesn't create that confusion, but a more unified messaging approaches. So that has worked effectively for us.
Great. Well, again, thanks so much for the opportunity to be here. I just want to acknowledge again, Nafissa, and your leadership, and also Laura, the U.S. Travel Association and all of your members have been really essential to keeping us moving and safe during the pandemic. So thank you to you and to your member companies. I'll just leave with one final message, which is conversations and communications really still matters. There are millions of Americans who are still unvaccinated. Of course, there are millions of children who are unvaccinated, and we are still in a public health emergency where it's important for us to do things like wash our hands, wear masks in indoor settings, and protect ourselves and one another from infection. This has been a long pandemic, and there's still a road and a path to go. We need to be encouraging each other. We need to be listening and having conversations with empathy. And the business community is a great partner and tool to share trusted information and facts with workers, with consumers, and with communities. We have a lot of great resources on our website for businesses, including a quick start guide, a communications guide, a conversation guide to help managers share vaccine facts with workers. All of our materials, including our events and training, are available for free at healthaction.org. And we're happy to meet with any public health official or business leader that needs one-on-one coaching. Just don't hesitate to reach out.
Well, everyone, please join me in thanking Nafissa, Stephen, and Laura. Just such tremendous insights. Thank you for taking the time to be with us today, and to all of you who are in our audience, for all that you are doing each and every day on the front lines of public health to keep our communities, employees, and consumers safe. We have up on the screen, in addition to these terrific insights that were shared today, we are also releasing a new resource created in partnership by the Public Health Communications Collaborative and Health Action Alliance, tips for a healthy holiday season. So a timely resource. This is a one-page resource and accompanying social graphic that can provide guidance for consumers to keep safe during the busy holiday season that is ahead. You can download it and it can be shared by both health departments and businesses, as well as other communicators such as educators. And we'll share a link to this resource in our follow-up to all of you today. For more of our resources on communicating about COVID-19, please do visit our PHCC website at publichealthcollaborative.org. Our resources include tips for a safe Thanksgiving, children and vaccinations toolkit, the COVID-19 booster dose toolkit, as well as some new shareable graphics, answers to tough Q&A, tough questions, and misinformation alerts. You'll also see a link to the Health Action Alliance resource portal, which has, as Stephen noted, a number of resources that can be shared with businesses of all sizes. And so if there are any business leaders who are tuning in today, as well as for all the public health departments who are on, whose local businesses may be interested, as Stephen noted, please do visit healthaction.org and sign up. So on our next slide, I just want to thank you all again for attending today's webinar. Later today, you'll receive a short survey that we ask you to please provide feedback on today's webinar. Help us in tailoring our offerings, and a recording of the webinar will be available on our website later this week. Now, just to let you know, today's webinar will be the last PHCC webinar for 2021. So we certainly want to wish you all a healthy and happy holiday season. And now we're going to continue, though, to send and share new messaging resources and updates via our newsletter throughout the remainder of the year through 2021. And then we'll look forward to joining you and having you join us for our next webinar with that series starting in January 2022. Thank you, everyone. That concludes today's webinar. Take care, be safe, and be well.